Good day, everybody, and what's up? Welcome to the podcast for Selfless Sex and She Comes First. I am Dr. Nick Myers, sitting here on January the 9th, a cloudy Sunday afternoon, and I want to thank everyone for the likes and the shares and the positive clicks on the very first podcast I did of the new year on sexual resolutions. It's doing very well, so thank you for that. I'm still trying to grow the podcast, as I say every week, and it's true. And for this week, it's a very important topic for everybody. It's on anorgasmia in women. And for those of you who are a part of the Facebook group, or the Facebook page rather, or either or, I'm going to try to post a research article on this topic in that group. So if you really want to sit down and just kind of go through it and read it, please feel free to. Sometimes I can post research articles. Many times, for whatever reason, Facebook is like, no, it's too graphic or something, whatever. But I will give it that old college try and just try to post it up there because some of the information is very important. You know, it looks back. It's more like a meta-analysis on like older research. But still, it's very important, and it's looking at the reasons why women are having issues when they're trying to have an orgasm. In today's podcast, I'm going to hit on 4 major elements that deal with anorgasmia: the symptoms, the causes, the diagnosis, and most importantly, the treatment options. So let's talk about that today. So let's start at the beginning. What is anorgasmia? And generally speaking, anorgasmia is the inability to have an orgasm, or there is a long delay in reaching orgasm that is distressing for you specifically. So not comparing yourself to what you see in the movies or in porn, or where the ladies are screaming their head off and everyone's just, oh my God, this is amazing. But it only really applies if this inability is distressing for you. And there are 4 general types or accepted types of anorgasmia. And the first one is lifelong anorgasmia, meaning that you've never ever had an orgasm. Back in the day, I believe it was called primary anorgasmia. Number 2 is acquired anorgasmia, meaning that you used to have orgasms in the past, but now you are having problems reaching orgasm. And back in the day, I believe that was also called secondary anorgasmia. Number 3 is situational anorgasmia, meaning that you are only able to have orgasms in and or under certain circumstances, meaning that you're only able to have orgasms with certain partners, or during oral sex, or during masturbation. But it's based on a specific situation. And number 4 is called generalized anorgasmia, meaning that you are not able to have orgasms in any situations or with any partners. Here, let's talk about some of the causes of anorgasmia. And there are 3 main types that I'm going to mention here: physical issues, psychological issues, and relationship issues. So under physical causes, let's talk about various and serious illnesses such as multiple sclerosis and Parkinson's can have an impact on one's psychological and mental well-being, which could interfere with them experiencing sexual pleasure. Gynecological issues, including surgeries, such as having a hysterectomy or cancer surgeries, that can have a negative impact on one's ability to experience sexual pleasure. And also pain during intercourse. So if you are experiencing unwanted sexual pain that's coming from vaginal dryness, something like that, that can have a negative impact on your ability to have an orgasm and or just to receive pleasure, period. Because why? You're in pain. Medications. And this is a big one. because many people are on antidepressive medications, but one of their major side effects is having a negative impact or negative influence on one's ability to experience sexual pleasure. And I'm talking about like Prozac and Zoloft, some of those very popular, antidepressants. Think about that. So don't forget to check your medicine cabinet, and also other like other blood pressure medications, antipsychotic drugs, and antihistamines. People don't think about that too, but those also can have an impact on one's sexual functioning. Alcohol and smoking. Now, drinking too much alcohol can really throw a monkey wrench in your ability to have an orgasm. And smoking, people don't think about this. Smoking actually can limit the amount of blood flow that's going to your sexual organs. And without blood flow, it may take you longer, or you may never be able to reach that sexual climax that you are looking for. And finally, aging. Yes, we are all getting older. So your anatomy will start to change, your hormone levels will definitely start to change. And once again, I go back to blood flow, all that stuff starts to change as you get older. So as especially like your hormone levels start to change, your estrogen levels and your testosterone levels start to change, especially in women, that can all have an impact on your ability to have an orgasm. And to keep going here, I want to talk about some psychological issues that can really have an impact on your ability to have an orgasm, including mental health issues such as anxiety and or depression. Now think about what the world is going through right now with COVID-19. And people are getting sick, people are going to the hospital, people are dying, family members are dying. So it's like the entire world is just going through this crazy mind fuck right now. So what's going to happen? We're going to go to the doctor and get a prescription for an antidepressant, which goes back to what I just said about 30 seconds ago. You see how these things all start to tie together? You can even talk about poor body image, where people don't actually see themselves as being sexual or worthy of sexual pleasure. Stress and financial pressures. Stress is a big one. Stress will throw water on any sort of sexual fire that is there. So if you're stressed out, like I always go back to COVID right now. Think about what everyone is going through, trying not to get it. And people are losing their jobs. Places are shutting down and closing up forever. So, but you still got bills, right? Right. So you see how everything starts to tie together. Cultural and religious beliefs. And some churches say some churches out there still say sex is bad. Some cultures out there still say sex is bad and gross, so save it for someone who you love. And that old line from back in the day. But that still can have a impact on one's ability to experience sexual pleasure and orgasm. Further, some people are actually embarrassed from receiving sexual pleasure, and or they can be embarrassed by the sounds that they make when they are receiving sexual pleasure. So they kind of pull themselves away, from the orgasm edge because they feel some sort of way about it. Guilt about enjoying sex, which can easily be traced back to churches and other cultural ideas and thoughts and things like that. So this is something that you need to keep in mind. And finally, which is a major one, past sexual and or emotional abuse. Because maybe you've been through something in your past which is impeding your ability, just your potential to receive sexual pleasure. And finally, relationship issues. And let's start here by saying a lack of connection with your partner. Meaning, back when you first got together, things were kind of hot and heavy, and then over the days or over the weeks or over the years, things have kind of cooled off. And it's not like anyone actually did anything, or maybe you're actually starting to grow apart. That's possible. Things like that happen over time. So that desire for sexual pleasure just is not there anymore. Unresolved conflicts. Maybe something happened in the past that was never really dealt with and it was kind of pushed under the rug, but it's on the back burner, but it's not off the stove. So it's still in the back of your mind. So when this person tries to reach out to you and try to give you sexual pleasure, it's just not going to happen because that thought, whatever it was, that event, that comment, whatever it may have been, is still sitting there in the back of your mind. So that unresolved conflict is going to impede you from your sexual pleasure. Poor communication of your sexual needs and preferences. So here, I always talk about Oprah moments where back in the day, she always talked about the importance of communication. Well, here's one of them. Because if you're telling your partner, or if you feel that you cannot tell your partner what you want and how you want to be touched, how you don't want to be touched, I like this, I do not like this, there's no way, for your partner to actually know what to do and to touch you how you like. And to take it a step further, if you do tell your partner and they don't listen and they're like, no, I think you would like this, so they're doing this thing to you that you actually do not like, there's no way, once again, you're going to be able to get to that point of sexual pleasure where you actually can have an orgasm. So yeah, you actually have to be able to speak your piece and have your partner listen and actually do those behaviors that you actually like. Infidelity or a breach of trust, which kind of goes back to the unresolved conflict, meaning that something happened or someone quote unquote cheated, and that idea, that concept of trust in your relationship is now broken. So that emotional piece is damaged. It's bruised. So once again, so when your partner tries to reach out to you, or let's take it a step further, would you even want this person to touch you if they cheated on you? In many cases, no. So there's no way on the planet you're going to be able to partner up with them and be able to reach, like sexual climax or have an orgasm with them. Why? Because you don't want them to even touch you. And finally, intimate partner violence. And here I'm talking physical violence and or emotional violence. Because people always think about the physical bruises that they can see, but the emotional comments, the negative comments, those hurtful words also can leave a very strong mark too. So once again, there's absolutely no way, if your partner is treating you like crap and telling you things that make you feel like crap, that you're going to be able to move on and actually enjoy sexual activities with them. Because it's, in many cases, like your body may just shut down when they reach out to touch you. Like your body may just shut down and be like, no, this is not going to happen, no matter what they do. Here, let's talk about the diagnosis of anorgasmia. It seems to be only just two major pieces to this, and they both involve doctors. So the first piece is getting a thorough medical history, which kind of goes back to what I said earlier, because your doctor may ask you about your sexual history, your surgical history, any current medications that you are taking, and they may be able just to see if those medications are having an impact or are known to have sexual side effects rather. And they may also ask you about the status of your current relationship, which goes back to what I said about 30 seconds ago. Are things going well? Are there issues? What's going on? And I'll say this again, this is definitely one time where you want to speak your piece and be honest about what's going on. Don't be embarrassed. And if you want to say something, just say it. If it's true, just say it. Yes, the doctors may ask you very pointed questions, and that's good. That's what you want, so that they will be able to find out what actually is going on. And number two, there's a physical examination. They may look at some other issues, so the doctor may give you a general physical, a referral to an OBGYN for, if there's any sort of other issues that are going on that are more specialized, because you may be suffering from like vaginal dryness or something like that, or there could be a cyst someplace that's making sex painful for you or intercourse painful for you. But yes, those are the main two things that are a part of the diagnosis of anorgasmia. And finally, number 4, I want to talk about some treatment options for anorgasmia. And there are two main elements under this topic: medical treatments and lifestyle changes and therapy. So let's talk with lifestyle changes and therapy first. And one thing you can do is learn more information about your body and how you like to be touched. Because if you learn how and where you like to be touched, it could lead to more satisfaction, more sexual satisfaction, and increased chance of orgasm. And this is where your doctor may give you like a quick rundown of your anatomy and talk to you about your erogenous zones. Because in many cases, women don't know this. They actually may not. So think back to like your own upbringing, or if you're in a church or your culture, many women were not taught these things, so they may never know. That little bit of education can actually help them out and actually talk to them about self-stimulation using their hand or a vibrator. And number 2, this goes right into there: increased sexual stimulation. Meaning, please don't forget that most women do not have an orgasm from penile intercourse alone. They need some sort of assistance. Like many women will orgasm from like oral sex and from masturbation, not from penile stimulation by itself. So there are certain techniques that you can do and or learn or try and incorporate them with your partner. Talk to a sexual counselor, which goes back to something I said a few minutes ago. If you're having issues in your relationship, that can have a negative impact on your sexual functioning. So having a sit down session with a counselor can help you work through those issues, then help you break through those barriers that were having an impact on your ability to have orgasms. There are also counselors and or sexual therapists out there who can really dig down and get into treating some of these sexual concerns that you may have. And some of this comes with a lot of education. I'm talking about communication skills and talking about and teaching you various exercises like behavior exercises, like hands-on exercises for you and a partner to try at home. And finally, medical treatments. And as I mentioned earlier, many women may be taking antidepressive medication or anti-anxiety medication like Prozac or Zoloft, and they are known to have serious sexual side effects, which include anorgasmia. So this is one case where you may have to talk to your doctor, and your doctor may change your medication to something else that is less severe, that will have a less severe impact on your sexual functioning. And also, estrogen therapy for postmenopausal women. And as you know, when you're going through menopause, your hormone levels are out of whack, and in many cases, they are decreasing. Your doctor may prescribe you a localized patch or a pill or even a gel, which will help out to kind of like counterbalance those hormone levels and actually improve your sexual response. Also, there are slow-releasing creams, rings, and or suppository that can actually help to increase the blood flow in the vagina to help and to improve your sexual response and sexual arousal. And in rare cases, they may actually prescribe testosterone therapy. Because people don't think about this, but yes, testosterone does play a role in female sexual functioning. Your dose would be a whole lot lower than what they would give to a male. The doctor may prescribe testosterone to you. But with that, there are definitely other side effects that come along with that. So that is rare in many cases, but it does happen. So in closing, I just want to say that I hope this podcast shines a light on a very important issue for many women out there. Because many people are going through tough times, people are stressed out, and they're taking various medications, which could have a negative impact on their sexuality and sexual health. And they may notice these changes, especially in their ability to have orgasms or their arousal, or they may be experiencing like vaginal dryness out of the blue and not understand why, or they're going through menopause and they're not really having a clue what's going on to the body and why is their body changing this way. And so I just want to breach that topic and breach this topic and talk about anorgasmia and some of the symptoms, the causes, the diagnosis, and some of the treatment options that are out there for you. And I really hope this helps you out. I do apologize that this podcast is a little bit longer than my usual 10-minute podcast, but there are just so many elements of this topic I just wanted to get through. So I'm pretty sure I would recommend for you, if you hear something that you like, just to do your own research and ask your doctor about it. So then if you are going through any of these issues, or you see something going on, or you see changes that are causing you concern, please talk to your doctor about it. And also, if you're going through some of those relationship issues that I mentioned earlier, there's always couples counseling to help you work through them, and or sexual therapy, where your therapist may want to meet with you one-on-one and then together as a couple, so then they and you can put together a plan, and so you can move forward and practice on like new techniques or different ways to talk to each other, to touch each other, so you can have great sex lives. Okay, so on that note, I'm out. You guys have a great day. Stay safe out there. Stay tuned, and I'll talk to you soon.